Hi, everybody. I'm Dr. Kesty, and today we're going to talk all about vascular lasers, what they are, what they do, and how we use them. Let's first talk about the wavelengths of what we use for vascular lesions. So, your three main wavelengths for vascular lesions are going to be 532, also known as KTP, 595, which is also known as PDL, and then 1064 or the Nd:YAG. So, let's get into how we use those every day in our practice. We use the KTP or the PDL for telangiectasias or broken capillaries on the face. That's the most common thing that we do in our clinic. The second thing that you can use a 532 or 595 for would be something like rosacea or background redness, or even some of the sun damage on the rest of the face. That's really helpful as well. The third thing we can treat with a 532 or a 595, that can be something like a vascular birthmark, port wine stains, something of that nature, and cherry angiomas, which are those small little red bumps that we seem to get as age goes on. Skin types get darker. So as you go from Fitzpatrick 1 to Fitzpatrick 5, you do have to decrease the energy of any type of vascular laser that you're doing. So you are going to decrease the energy as the skin tone gets darker, which may mean that you need more sessions. But the most important thing is that it's still going to be safe in application in darker skin tones. The leg vein lasers, or what we use for 1064, are going to be leg veins and periorbital veins. So meaning in and around the eye, those dark blue that can lead to some hyperpigmentation in and around the eyes. That's what we use the 1064 for mainly. So that's going to be the wavelength that targets leg veins and periorbital veins. When it comes to using a vascular laser in scars, you want to use a 532 or 595, and you have to specifically look at the scar, because if there's background redness, you're going to turn down the energy. But if there are specific vessels that you're going to go after, then you're going to use the telangiectasia setting on your vascular laser. And that's going to be the most effective, kind of depending on what the patient looks like or what the scar looks like. You can use both 532 and 595 to effectively get rid of the redness in that scar. You just have to assess where the redness is coming from. Is it just the whole scar is red, or if there are specific blood vessel? Most commonly in my clinic, I am starting with a vascular laser whenever I talk to patients about laser resurfacing, mainly because I live in Florida and every one of my patients has sun damage, and most commonly that shows up as broken capillaries, especially on the cheeks and around the nose. And a lot of my patients are wanting that even skin tone. So if I do not attack the background redness or broken capillaries, I'm not going to achieve that. So if I pair a vascular laser with further resurfacing, that's going to be the best patient outcome. Most commonly, the recovery from a vascular laser is relatively short. After the procedure, you may notice some mild bruising or some mild swelling or redness in and around the area that was treated, but that usually fades within 24 hours. So it's a really good, relatively no downtime laser, especially if you have to go back to work the next day, but you're still going to get a really good result. Sessions for vascular lasers, I always tell my patients, your goal is going to be between 4 and 6 sessions. Now, it sounds like a lot, but these capillaries or the blood vessels or the redness, they came from somewhere and they have a source that's deeper. And so to go after that effectively, we have to multiply the sessions just to give you a longer lasting result in the end. So some of my patients either have, resistant vascular birthmarks or even just really resistant vascular lesions on the face. What I usually do is I pair a vascular laser with a CO2 laser, and I found that to be very effective because some of the heat damage that the CO2 can impose deeper actually tightens the collagen around the feeding vessels, and that can give you a really nice result, especially in those lesions that are resistant to just a vascular laser alone. All right, so that was an in-depth look as far as what vascular lasers are, what they can do. Please DM us if you have any further questions. We'd be happy to answer them, but I hope you learned something about vascular lasers today. Thanks so much.